seminars here at New Haven Pet Hospital. This is our second seminar. We did one on dentistries. And so we hope to be able to offer more seminars, but we'd like to provide them on topics that you guys are interested in. So one of the sheets that you picked up is the blue sheet, some feedback for us. If you guys have interest in certain topics that you'd like to hear about, we're thinking about doing these quarterly, so every 3 or 4 months. So please provide that for us. We'd like to do things that you're interested in. And we have things that we like, but we want to make sure it's stuff that's relevant to what you guys see all the time. So one of the sheets you picked up is that. If you'd like for you to make sure that you fill that out when you get a chance. There's cookies and water in the back. I know this is dinner time, so we provided some of that for you, so use that. We've got the handout for the topic that I'm going to go over tonight. What else? There's going to be drawings. I don't know if everyone put their name on a little ticket. We're going to draw for some gifts at the end, so if you didn't put your name on a ticket, raise your hand. We'll bring it to you so you can put your name on it. We're going to be raffling those off at the end. Any other housekeeping?
I don't think so. I think you're okay.
Well, let's go ahead and get started. This topic tonight's about allergies, and I titled it, "What's the Itch All About?" because that's, I usually have someone come in and say, "Why is my dog or cat itchy?" So first of all, I want to talk about our goals for the seminar tonight. Biggest thing I want you guys to understand is, what does it mean to be allergic to something? I want you guys to be able to log out here tonight knowing what that means. I want you to understand what common symptoms are of allergy dogs and cats, so you can recognize those in your pets. I want you to know that there's different types of treatments, and be aware that there's many different treatments. You may have your animal on certain ones and not others, and you want to ask them about those other treatments. I'm going to give you some tools that you can use at home that will help minimize allergies in households. And that's important for you guys to be able to do. I mean, you don't want to come see us all the time. We love it when you do, but at the same time, we want you guys to be able to do things at home too. And to recognize that allergies are treatable, but at this point in time, they're not curable. So we do the best we can to treat them. Now, all the written things in the seminar are actually in your handout, so I provided that for you to take home. We're going to go through a lot of information, but I want you to be able to refer back to something so you guys have that to be able to take home. If you lose it, we've got extra copies. Feel free to have those if you didn't get one. So first of all, I'm going to talk about allergies, the different types that we have. And we're really going to talk about primarily that first one, allergic inhalant allergies. That's the one that we see about 70 to 80% of the time when you come and see us. We call it atopy, allergic dermatitis. It's really the 3/4 of the time that's what we're dealing with. I'm going to touch on the second topic a little bit towards the end about food allergies, because that's kind of another one that we see, and it gets a lot of buzz when you go to the pet stores and buy food. They talk a lot about things, and it is kind of our second category. 5 to 20% of dogs that are itching are certainly going to be some food allergy dogs. In cats, interestingly enough, more commonly in cats than it is in dogs that we see. The third type of allergies is flea allergies. Thankfully, with the medications that we have now, I just don't see many fleas. I mean, we still see them. Boy, 12 years ago, 13 years ago, when I came out of veterinary school, I just saw fleas all the time. We've got some great products now. If you see fleas or you're having problems with fleas, you let us know, because anymore, if you keep your animal on a flea product, we're just not going to typically see them. The last type of flea allergy, the last type of allergy that we see is a contact allergy dermatitis, which is when you come in contact with something that you react to. We don't see a lot of it in pets because they're covered in fur, thankfully. We do see it on their belly sometimes, but that's a type of allergy that we'll see. So first of all, I want to talk about something called allergens. And when an animal is allergic to something, its body is overreacting to certain molecules called allergens. And these are molecules that are in the environment everywhere. And I don't care how clean you are, this little character lives in all of our houses. He's a dust mite, and no matter how clean you are, you're going to have some dust. They're going to be living in carpets, they're going to be living in your pillows and in your furniture and that type of thing. So we're going to talk a little about that as an allergen. Mold, interestingly enough, houseplants are one of our most common mold issues that we have inside. Grasses right now, a big issue right now for our allergy patients is grasses. So these are all allergens that are in the environment, and animals are overreacting to them, and that's leading to some of the symptoms of allergies. Make sure I go the right way. So other allergens are pollens, weed pollens like ragweed. That's this little character right here. That's our biggest fall allergy, so that's the culprit we'll see you many times in for September all the way until the first frost is because of that ragweed. Trees are a common problem that we're having right now, so one of the big reactions that you're having is the grass and tree pollens. we see. So these allergens, I remember to go the right way. Get it. There we go. Another allergen is the fleas that we've talked about, and proteins. Interesting enough, foods. So beef and dairy are two top offending agents for allergens as far as food allergies are concerned. About 80, 89, 90% are going to be beef and dairy. You're going to learn to do it the right way. So this is a schematic, and by the end of this class tonight, guys, you guys are going to be able to draw this yourself. Not really, but I do want you to kind of understand what the allergy reaction is so that you can feel comfortable with what that's all about. Okay, so when allergens are inhaled, and those are the things that we just talked about, the grasses, the pollens, the weeds, those are inhaled ingested or come in contact with the animal's body. Then what will happen is this little mushroom-like character right there, that's the allergen. And it gets ingested into the body through the skin or through breathing it in or through ingestion, and it presents itself to these immune cells called B cells, basically. And what happens then is our body will then make antibodies against that allergen. So here right now, these are little antibodies that we're making against it. So if you come in contact with a pollen of some type, it's going to present itself to this immune cell, and we're going to make all these antibodies against it. Okay? And then what's going to happen is this protein is produced in large amounts. It's going to make IgE, that's that antibody, and it's going to attach to these mast cells, okay? Now this is the first time you come in contact with an allergen. So the first time you see bee pollen, the first time you see fleas, it's going to attach to these mast cells and it's going to sit there and it's going to wait. Then, I'm going to figure this out towards the end. When the animal comes back in contact with the allergen right here, all these antibodies that have been sitting on this mast cell is going to cause a massive reaction. It's going to cause this mast cell to release all these chemicals. Histamine, there's actually 6 different chemicals that will release. Histamine is one of them. Cytokines, leukotrienes, and others are going to be part of that. And that leads to that massive reaction that we see in the body. Now, for animals, these mast cells are located primarily in the skin. All right? So when they release these irritating chemicals, that's where it causes the problem, in the skin, itching. In people, interestingly enough, our mast cells are primarily in our respiratory tract, so our eyes, nose, and lungs. So what I want you to realize is, when you're doing this, and your dog or cat is doing this, you may very well be reacting to the very same thing and have the exact same process going on. It's just an anatomical difference as to why we look different, okay? In people also, as in, well, in animals, in people it's really heavily investigated, and animals we're just now starting to research it. There's also believed to be a barrier defect in our skin. So this is kind of a level of skin. These are just cells, skin cells right here, and then these are fatty acids. Ceramide is one of the big things that we see. This is called the brick and mortar hypothesis. So we've got brick right here and then the mortar here. And basically what happens is in people with allergies, and we believe the same thing is happening in animals, is our cells don't quite line up right, and then these fatty acids aren't really protecting the way they should. And so what will happen is this water will get lost out of the body, and then you'll get bacteria and yeast and allergens will then be able to seep in there a lot easier. And you will have more problems because of that, all right? So think about that there might be issues in our genetics that will cause that. So those then will cause that histamine produces and cytokines. All then will also help release right there in the skin. So you have 2 different things that are playing a role at this point in time. In dogs, we also know that there's a genetic component to things. And in people as well, actually. We know that there are certain breeds of dogs. These aren't all of the ones, but these are kind of our top that we see. These will many times present to us with allergies, and there is a genetic component to it. All right. In cats, interestingly enough, right now, cats always do things differently. They're not small dogs. I tell that to people. They're not small dogs. At this point, there's no genetic factors found in cats. So, what are the clinical symptoms that we see with allergies? And you guys see this at home: itching, licking, chewing, scratching at the body. Many times there'll be hair loss due to self-trauma. Sometimes we'll see it just in the spring, sometimes just in the fall, or both. Many times it will start off as seasonal, and then it will become all the time as they develop more allergies to more allergens. Biggest thing I see, 2-year-old coming in with chewing on their feet, rubbing their face on the carpet. Many times, there are some dogs that all they get are skin infections or ear infections, and I don't hear too much about chewing or licking. But we will many times see them come in with ear infections and skin infections. And about 15 to 20% of those cells are also located in their respiratory tract, so they do have some of the same problems that we do with the red itchy eyes and the sneezing. It's just not what we commonly see at this point in time. Go backwards the entire seminar. So here's prime candidate right there. Look at the hair loss right there. Your dogs and cats have probably looked very similar to that dog. A little close-up of that hair loss. You can see kind of there's dry skin. The hair coat just doesn't look very happy. Here's a little more close-up. You see red, irritated skin. This dog's just been itching and going to town for a while. This is 2 weeks after therapy. You can see that hair kind of has the gloss kind of coming back again. There's still some hair loss. I didn't get a great picture. There's still hair loss, but the hair's starting to come back at this point in time. So here's a red, itchy leg. This dog is just continuing to chew on itself. Here's what we call a hot spot, where they get really red, irritated lesions, and animals just really start digging at themselves. More hot spots on the neck of a dog right here. We've clipped them up so that they can heal a little bit faster, but red, irritated, there's some infection in here as well. This dog presented with just a terrible ear infection. Its eyes are right here, ear coming up right there, but just a terrible, terrible ear infection at this point in time. This is a circular area. We call these bacterial collarettes. So this is a skin infection dog. It's a little bit of a close-up, but you guys maybe have seen some of that on your animals. This is a cute little dog that came in last week. Right there, it's a paw licker. So you can see it's got saliva stain. When you lift up that paw, oh, just red, irritated, infected, probably a yeast infection, bacterial infection going underneath those paws. That dog was just digging at his paws all the time. This is a staff member's dog. This is healing up circular lesions. These are the bacterial infections that you'll get on the skin sometimes after they've been licking so long. Here's another dog, red areas. This dog's been kind of chewing at himself, some red eyes. This dog sometimes gets some red eyes as well with the allergies. And this dog is, I kind of tell them they're flaming red. This dog's just really, really red, irritated, sensitive, hot to the touch. Here's another picture. You can see how red and irritated that dog is when it has allergies. So, there's a lot of different symptoms. Once again, we're going to go back to cats. They do things their own way. So cats sometimes will present just like a dog, and sometimes they'll present with these, we call them eosinophilic plaques, these longer lesions. They can be long lesions, like this almost looks like a worm in a cat. And then these are what we call rodent ulcers, so they'll get these lip ulcers in cats. Unfortunately, a long time ago in early veterinary medicine, I think it was late 18th century, they believed that cats were being bit by rodents, so that's why it got termed a rodent ulcer. But anytime you see a cat come in like this, it's an allergy. Okay. This is a Max, another cat, one of our staff members' cats here. This is Max going to town on his own legs, just really looking. Cats can cause a lot of trauma to themselves really quickly because they've got that rough tongue. So geez, in no time they can really cause some problems. So typical patient we start to see around the age of 2 to 3 years. And if you go back to that first schematic that we talked about with allergies, it's because it takes time to build up those antibodies. The first time you see something and you're allergic to it, you're not going to react to it. It's that second time when those cells, those antibodies have been made that you're going to be set up for that big reaction. If you ever know someone who's stung, who has bee allergies, I guarantee they've been stung one time by a bee and didn't have any reaction because they weren't sensitized to it. But then that second time, that's when they reacted to it. Our patients are the same way. So, many times that first year, you're not seeing us at all. But then around 18 months to 2 years, you start seeing those licking at the paws, scratching themselves, and I start to worry a little bit at that point. Are we dealing with an allergy patient? Many times if you move into a new environment, that first year, you're going to be golden. Everything's going to be great. I had a client this past week who says, yeah, my dog hasn't had allergies since we moved to the new apartment. We had no carpet in the new apartment, and I kind of went, how long have you been there? And she went, 3 years. And okay, 3 years. This dog's probably going to be okay. It's not developed any at this point in time, so hopefully we're going to be safe. But many times we'll get away with it for a while. So to diagnose, you guys might be surprised to hear at this point there's no test to diagnose for allergies. We don't have some magical little blood test that we can just pull and say, yep, your dog's got allergies, we're gonna treat like this. We really just have to take the history, how old the animal is, have we seen it before, what are the clinical symptoms, and then sometimes we'll just do some treatments and see how your pet responds, and go from there. Certainly, things I'm going to do is I'm going to be looking for other reasons why. Fleas, if you've ever been with me at an appointment at a 2-year-old age, first time you see me, you're like, my dog's like that's paws for the first time. I'm going to be hunting really hard for a flea, because I'm hoping your pet has fleas, because it's a lot easier to treat. At 2 years of age, if I don't find a flea, I'm like, we might be dealing with allergies at that point in time. But we're going to be looking for other things, like yeast infections, fungal infections, bacterial infections. Mites is a big one that will cause some itching in dogs. And thyroid disease can also lead to skin disease. Now realize your pet can have allergies and all of these things too. We just want to make sure that we're being thorough and looking for other things as well. So we talked about there's not a test for allergies specifically, but can you test for allergens? And whether your dog or cat is allergic to something in particular. And we can, just like you can in people. You can test to see if they have allergies to certain types of pollens or certain types of grasses. You can go to a dermatologist and they can do the skin prick test, which is the exact same thing they do in people, where they can take allergens and they can put them on the skin right here. You see those black dots is where they put them on, and then they'll prick the skin a little bit and let them absorb, and then they'll watch and see if the animal responds to them. So if they overreact, this is a positive reaction, this is a negative reaction, then we know that most likely that animal is allergic to that allergen. And that can help you to make up something to do at home so that you can avoid those specific allergens, or it can help you as far as developing a vaccine for immunotherapy as a treatment protocol. There's about 70% efficacy for that, for improvement of clinical symptoms, so it's not perfect. But just like in people, you get about 60-70% efficacy. Does not test for food allergies. This is a little bit different than in people. In people, they can test for some food allergies with the test, but in animals, it has not been properly assessed at this point in time. We can also, here at a dermatologist's office, to have the skin prick test, but there's dermatologists in Indianapolis. There's some fairly closer ones that we can use as well. We can also draw some blood and look at some serology, and we can look in the bloodstream specifically for those specific IgEs that we were talking about. Those are the antibodies that you make. So you have antibodies against molds and weeds, and we can look for that in the bloodstream. And then we can decide then, okay, we can make up a vaccine, and we can help you with some avoidance therapy as well. That's about 65% efficacy. I'm not sure if it works as well as the skin prick test, but pretty darn close. Once again, this one does not do any food allergy testing as well, so that is not accurate as far as food allergy testing. Okay, so I've given you some information. I just thought it would be a little bit of fun facts. Right now we're about halfway through the seminar. It can get a little overwhelming with information, so I just want to do a few fun slides to bring us all back to life, and then we're going to continue on. So, number one, how many dogs do you think survived the Titanic scene? Anybody have any ideas? One? We got one? How many dogs survived? There are dogs that lost their lives on the Titanic, but there were some that survived.
All of them.
All? That's a negative on that one. Like 3, 5, or 6? 4. 4? Let's see. 3 dogs. Obviously, they're from the first class cabins, probably most likely. They survived. 2 Pomeranians and a Pekingese. They've even got most of them. They know who they owned them and everything. But most of the first class people were able to hide them under their coats, and they believed that they were babies. Is usually how the dogs come out.
Oh my!
Several people lost their life going back to get their dog, and then by the time they got back to life, it was done. So, unfortunately, there's those stories too. All right, how about this one? Why are dogs' noses wet? You guys have a dog nose wet? My nose is wet. Why are dogs' noses wet? You guys have any ideas? Cooling system. What now?
Draining tears.
Draining tears. You guys have any other ideas? What do you got?
Does that have something to do with that little cut right there in the tip of their nose?
I don't think so. All right, you ready? So they secrete a thin layer of mucus that helps them absorb a scent, and then when they lick their nose, they can sample that scent. I didn't really know that one. That's kind of interesting.
Oh my gosh.
All right, so a cat jumps 7 times as high as its height. How high do you think a flea can jump? I'm on inches. Anybody got any inches?
12 inches.
12 inches? 14 inches?
60.
60? 7 inches up and 13 inches long. Doesn't sound like, but if you put it in human terms, it'd be like a 6-foot person making 160 feet up and 295 feet long. So they're impressive creatures, fortunately for us. All right, last one, then we're gonna go back to learning again. They did a study to find out, they asked pet owners, over 1,000 pet owners, if they were stranded on an island, who would they want to be with, their human partner or their pet? Percentage-wise. How many think chose pet?
65.
65?
90%.
Got some issues going on. 67%, you guys are right on target, so I'm not sure what that all means as far as our human relationships.
Yes, females, right?
That's it. All right, so we're gonna jump into treatment now. And, you know, just like there's no real test at this point, there's just not a cookbook for sure treatment protocol either. And I tell people you kind of do what works. You find what works for a specific patient and you do that. But there's a whole list of things I'm going to go through here because these are all the options that we have. And there's quite a few of them. We may not use all of them for each patient, but I want you guys to kind of have the knowledge for all of them at this point. So the first thing we want to do is we want to identify and look at all other infections that are going on. Because you can't just treat the allergy and then have other skin infections. You've got to kind of treat the whole patient at that point. So like this dog had a raging ear infection right here. We got a lot of material out of there and we were able to treat it. So many times we'll be cleaning those ears out, we'll be sending home medication. We can find medication here in house for you. We want to make sure, because commonly these animals will have ear infections going along with it. The ears are an extension of the skin. And so when the skin gets inflamed, the ears will also become inflamed. And really the only thing they can do is produce more wax. We have yeast and bacteria that naturally live in the ear canal, that live off of that wax. So when your animal makes more wax, that allows the yeast and the bacteria to overgrow, and then you get that ear infection going on. So we'll clean your ears out, start medicine. We'll have you start, hopefully, routine ear cleanings if possible to prevent those future ear infections, because we know after an animal gets a couple of ear infections, unfortunately it sets them up to be predisposed to having more and more ear infections. It permanently changes that ear canal. And that's kind of a sad thing, unfortunately, for us with our allergy patients. Skin, we've already talked about skin infections. You saw some pictures of those. We're going to want to make sure that we're looking for bacterial and yeast. We can swab those as well if necessary. But we're going to be wanting to treat those all at the same time, okay? That's us. It looks like the dog's smiling, but I don't think really. That was a really nice dog in for an ear clean last week. So we're going to jump into corticosteroids, and I kind of want you guys, this is why we're going to, I brought this to you because I want you to understand where all these things kind of work, because we're hitting things at different points to try and really stop allergies. Corticosteroids, if there was a magical cure for allergies, and I don't have it for you, but if there was one, it would be corticosteroids. It really just shuts this mast cell down. It just completely stabilizes it so it doesn't release all of those irritating agents, all those leukotrienes and histamines. I don't know if you've seen the commercial, there's a nasal spray, I don't know what it's called. Yeah, it's kind of an irritating commercial, and 6 is greater than 1. Have you guys seen that commercial? 6 is greater than 1. Well, it's basically, it's comparing, it's a corticosteroid. And so it's saying, okay, because it's a corticosteroid, it's not allowing the mast cell to release any of those 6 chemicals. And it's comparing it to an antihistamine, which only stops histamine. So that's 6 is greater than 1. Corticosteroids really shuts that down, and it keeps it from releasing those chemicals. The problem with it is that there can be some issues with cortisone, so we don't use it as much as what we would like to. We want to use it just short term, just to really break that itch cycle. Because a lot of these animals are uncomfortable, and you guys are coming in with me, you got bags under your eyes, you haven't slept for days. And we really need to make sure that we get this animal comfortable as quick as we possibly can. So it works really great. We've got injections, we've got pills. But the problem with cortisone is that it's got long-term side effects and some pretty severe ones. So we really don't want to use it all the time if we can avoid it. I certainly tell people no more than 3 or 4 months out of the year do you want an animal on corticosteroids, and really the least as possible if you can. Sometimes it causes short-term side effects like peeing and drinking. That is, excess peeing and drinking is pretty hard to deal with sometimes. We do have a pill that's a cortisone and antihistamine in a combination, so that's kind of nice to use as well. So cortisones is a really good thing to use short-term to help us really knock that allergy level down to a more manageable level with other medications. The second thing I want to talk about is antihistamines. So I already kind of alluded that it once again works right here also. It works just against the histamine chemical. So it stops the histamine from being released from that mast cell. It works well with mild itching. So, you know, if you've got an animal that's really going crazy on itself, antihistamines tend to get a little bit more overwhelmed just because it only hits that one irritating agent. Minimal side effects though, it's great, it's cheap a lot of the time. We've got good ones that have been out for 15 or 20 years that are safe in animals. We can use it long term, we know there's minimal side effects to it. So we really like to use this in conjunction with most of our allergy patients. It's a really nice way to go. You can use it with all kinds of things, it doesn't really have any interactions with things. We've got all different types of antihistamines. We've got ones that were older ones that are first generation antihistamines, and we've got newer ones that you can use like the Zyrtex and Claritins. They're just more expensive. And so we tend to typically stick with the older ones because they're a little bit cheaper. And the dogs don't seem to be as sleepy as what we are with some of those antihistamines. And so that's a nice thing that we're usually using with these allergy patients. We'll get it till the end of the seminar. Another thing that you guys are maybe used to doing is topical medications. And that works really, really well for us too because there's not a lot of side effects to topical medications. It only gets absorbed typically into the skin. And so you're not getting suppression of the immune system. You're not getting some of those nasty side effects you get with cortisone. So shampoos, we've got some nice new shampoos that's come out in the last couple of years that actually treat for bacterial infections and actually treat for yeast infections. You have to kind of leave them lathered up for about 10 minutes for them to work properly, but they work really, really well. We've got leave-in cream rinses now that will help control itching. Like I said, all these bacterial and yeast infections, they'll help soothe those red inflamed skins. That first black dog, I don't know if you remember in the very first picture, had what we call the dry or oily skin, the seborrhea. These will really help with that. It just requires you guys to get baths, and sometimes that's easy and sometimes it's not, depending on your pet at this point. We've also alluded at the beginning about that oil barrier. Some of those people as well as dogs don't have the proper oil in their skin, and so these will help you replenish some of that. So it hits things just a little bit differently. Topical medications go right along the line with the shampoos and conditioners. They're very, very safe. They control itching, bacterial infections, and yeast infections. It's just you can't lather the whole dog in them. So if you have spots that are affecting the animals or if their paws are really irritated, these are nice because we can have those creams put on there. We've got a spray that will also kind of help control some itching that we can use when they're having those types of issues in certain spots. The shampoos and conditioners are nice because you can treat the whole patient, whereas these are more kind of for spot therapy. Another thing is, I don't know if we've ever talked about all of you, is essential fatty acids. So those are the omega-3 fatty acids. We know that allergy patients, people as well as animals, have an abnormal fatty acid metabolism in their skin. And so if we can help balance that for them by replenishing some of those omega-3 fatty acids, then that will help with that. You get omega-6 fatty acids from your diet, so you don't need a lot of that in a capsule form. But the omega-3s are the ones that our bodies produce. And so in those animals that have an improper barrier, that's where you want to supplement them because they're not going to get them from their diet very well. So we have, products that are made specifically for animals. We find that in literature shows about 50 to 60% of them will improve with it. So it's, once again, it's kind of an add-on therapy. They're very, very safe. No side effects whatsoever really to essential fatty acids. You can snip the tip right off and just squeeze some right on the food. So they're pretty, it's not like you're giving them a pill either, so they're pretty easy to give as well. Another type of treatment is called cyclosporin. And some of you may be familiar with cyclosporin. It's a human drug that is used for transplant patients and autoimmune patients. And basically it works, we call them helper T lymphocytes from releasing chemicals, but it works really right over here. So it works in preventing these types of cells from being able to present the allergen over to the mast cell. So like we talked about before, if you use allergy medications, you're hitting them in different levels. So we talked about hitting it here, we talked about now hitting it here. We're really trying to break this reaction in different places. And so cyclosporin will prevent these cells from being able to present that allergen over and causing more IgGs to be produced. Cyclosporin is a great product. We've had it out for several years now. It is a dog and cat product. It works well in about 50 to 60% of animals. But once again, it's messing with your immune system, just like the cortisone is. Not as bad as cortisone. It has less side effects than cortisone does. But it does have some long-term side effects. It can cause some issues with the gums. Usually if we back it down, we start higher dosages for 4 to 6 weeks, and we'll back it down and get as low as we can. And there have been some animals that this is kind of their magic bullet, and it's worked really well. Biggest downside of Atopica, the cyclosporin animal product that we have, is it's just not the cheapest product out there. And unfortunately, it doesn't move it very fast in the practice there, unfortunately. So, but that's an option that's out there at this point. It's dosed by weight, so the smaller dogs tend to get off a little easier than the bigger dogs with that product. An exciting new product that we've been exposed to for about the last 2 years is a selective JAK inhibitor, is what we're calling it. This is a brand new class of drugs to the animal world. There's a few drugs that are out for people for selective diseases. But basically what this does is it inhibits the function of the cytokines that are released. So once the mast cell releases the cytokines, we had a gentleman talking today about this, and he kind of called them text messages. These are chemicals that text message to other cells, basically. We can kind of relate to that in this day and age. But those cytokines will go to the nerve cells in the skin in animals and will cause them to itch. And so what this product does, it's very selective. It goes right to those specific itch cells, and it will shut down that text message. So the itch cells don't get it at this point. The nice thing about this product is it's so selective. It's not messing with the immune system whatsoever. So this animal is able to have a normal immune system. It's just messing with that itch factor that we'll have in those animals. So this is a very exciting new product that we've been able to get more and more of. Minimal side effects. It's new, so we don't have a lot of long-term studies, but the studies that we see so far look like it's a fairly safe product. The goal is to replace cortisone. So you use it with other medications like the antihistamines and the other medications we talked about, topical medications. But it's really just to stop that itch right at the skin level. At this point, there's no cat product. I'm not saying there won't be. It's just the cats tend to lag behind in studies because more people are willing to, unfortunately, spend on dogs. That's just the reality of it. So there's a dog product only at this point in time. The biggest problem we've had with this product is its availability. The company kind of messed up last year when it brought it out. It didn't have enough, and it takes a while to make its product. And so some of you might be on it, but we just don't have a lot of it at this point in time. When you look at the bigger dogs, it's a bit pricey, but at the same time, we have probably 80% success rate. I don't know, what do you think? 90% success rate? Very good success rate on it at this point in time. So this is probably our most exciting product that we've had in the last couple of years because it's got minimal side effects to it, and it doesn't regulate the immune system in any way, which is good, so that an animal can go and fight off colds and have a normal life without us having to worry about whether or not there's going to be some issues as far as
What is the cost factor?
Yeah, I mean, on bigger dogs, it's not as cheap. Steroids are cheap, so it's certainly a little bit more expensive than the steroids. It's not as expensive as the atopic is. Yeah, it's certainly cheaper than atopic. So as we get more and more product, I assure you, we will probably be putting any animal that comes in on itching with allergies. It'll probably be going home on that. It's a very safe product. It just doesn't interact with things at this point. Bigger dogs, I haven't looked to see what the price is for bigger dogs. Have you?
I put a 16-pound dog on it today, and it was $72 for the month.
72. So it's, yeah, so, and how big was that dog?
16 pounds.
16.
Yeah.
Well, now but that's twice a day dosing for a couple weeks. So we
Right.
start off at twice a day, then we back it down to daily, then we go to every other day. So it would be, the lower dosages, maybe $20. So for 15 or 16 pound dogs. So the bigger dogs are definitely gonna still be paying a little bit more for that at this point. Treatment, I don't know if any of your patients are on immunotherapy at this point, or many of us have had, has anybody had immunotherapy? Yeah, I've had it as well. And so basically what we talked about earlier, where you want to identify the allergens that the animal is allergic to by either the skin test or the blood test. And then what we'll do is you'll make up a vaccine made specifically for that pet. And we don't jump right into immunotherapy because it can be expensive as well, and it requires injections. But it's certainly recommended if medications aren't enough to control symptoms, and that's something that we really think about doing. We do blood tests in here, quite often. We'll be able to identify those allergens. So immunotherapy, the way it works is it retrains your immune system. And it's the same as it is in people. So if you had immunotherapy, the same thing happened to you. If you give injections of an allergen, so if you do the test and you find out what you're allergic to, they'll make an extract of those things in small dosages. And then what you do is you give injections of those. And when you give an injection to your body, it doesn't make IgE antibodies, and it actually makes IgG antibodies. Your immune system does. So IgG rather than IgE. And the IgG antibodies don't attach to the mast cells. So if you can overwhelm your body with a bunch of different antibodies called IgG to a pollen, and only have a few of the IgEs, when you come in contact with that pollen, the theory then is it will attach to IgG antibodies rather than the E antibodies, and it won't even come anywhere near this mast cell, and it will cause the mast cell to release. That's the theory. So you retrain your immune system over time. You flood it with different antibodies that won't attach to the mast cell, and it works. It works pretty well. It's just you have to be patient with it, and unfortunately. Our pets just don't live as long as we do. I mean, I started immunotherapy when I was in the 5th grade. I took it till I was 18 or 19, and I stopped at that point when I went to college because I became poor. Was now my parents' insurance. And thankfully, I never had to start back up again. But you think about it, I was on for 8, 9 years. Well, how does an animal live? So their lifespan starts to play a little role in here. Many times you won't see much improvement for the first 6 months, and then after a year, hopefully you really start to see improvement as we flood their body with a different type of antibodies with them. And then you increase the amount of allergens you're giving them over time. We show you how to give the injections, and so eventually it gets to be a once-a-month injection for the animals. But it may take a while for us to see improvements. And once again, when you see improvements, it's only about 60 to 70% will show improvement of clinical symptoms. There's not a cure rate necessarily at this point. So you may give injections for years, just like you all took injections for years. And we will many times still be using allergy medications along with it. But I have had some patients who really have done well after starting it. And in some of those, we can even stop at some point in time. But I've had plenty as well where it helps. It just isn't the magical bullet for us at this point. Once again, no food allergy issues. I know that we send out a blood sample to a lab, and many times we'll get food allergy results, and it's just not true. Time and time studies have shown that you cannot test food allergies in animals at this point with either a blood test or a skin prick test at this point. A new thing has come out recently. If you can't give injections to your animal, we can do oral medication by mouth. It's daily though, and it's about twice the price. But that is an option that's out there as well. They can make it oral that they really will make work as well. We do have some alternative therapies if you're interested in that. There are some essential oils that have been found to be helpful. Some lavender, lemon, peppermint. We're just starting to dabble in this a little bit on the animal side. We've got a product that's in-house now that the company's made that's Essential 6 is what they're calling it. It's essential oils. So, more people are recognizing that some of these alternative medicines might be helpful. And so it certainly is an option that we have to be able to utilize if you're interested in something like that. So things that I want also to talk about is things that you can do at home. to help with things. So we've got all kinds of drugs. As you can see, I just went through a list of drugs, and there's all different types of therapies we have, but we don't want you to be giving your animal medications, 6 or 7 medications every day. If we can help reduce some of the allergens that you have at home. So I wanted to give these tools to you guys, and they're in your handouts. It's things that you can do at home. Biggest culprit that we see in allergies in people as well as pets, indoor-wise, is dust and dust mites. And I remember, I'm sick earlier to dust and dust mites, and so I remember as a kid I slept on a plastic pillow, and it was horrible. So I was kind of happy when I researched this topic a little bit. I kind of learned that they've really come a long way. I haven't researched plastic pillows in a long time. But now they've got all fancy bedding and pillows that you can put, the covers you can put on for your pets as well as people. And so, do a little researching online. If you're not interested in, if you're not able to do that, we can help you with that. But there are certainly plenty of companies out there that are making products now that are helpful. So if you want to cover their bedding or pillows, that you can do that with things. The drier things are in the house, and the better off things are going to be as far as humidity is concerned. So you're going to reduce that dust mite. The dust mite doesn't like to live in dry environments. You want to use your air conditioning as much as possible. I always laugh at people who, they'll tell me that I haven't turned the air conditioner on yet. It's June, and I have mine on in April because I'm allergic to everything, and so I'd rather just not have my windows open if I can avoid it at that point in time. But use your air conditioning when you know that you can at that point. Wash your bedding weekly, so wash the pet's bedding or your bedding in hot water as hot as you can get. You kill off these dust mites with 130 degrees temperature. So you do that once a week, you're going to really reduce those dust mites down. And believe it or not, drapes, upholstery, carpet, all that just holds those dust mites right in. So that lady who was so happy she moved to an apartment 3 years ago, she said it was all hardwood floors, and she had just convinced that it was the carpets for that dog. And I had another guy who he takes his dog in for therapy to hospitals and retirement homes, and he won't go to a certain retirement home right now because the carpet believes that every time he goes and puts that dog on that carpet, his dog has severe allergies and reacts. And so, there is, if you can replace those, now that the hardwood floors are coming more back in fashion again, that's something that we might see some of these dust mites might go away a little bit more. Certainly when you're vacuuming, you're just moving all those around, so you have the animal out of the room while you're vacuuming, even for hours is what they say. It takes time for everything to kind of settle back down again. If your dog has allergies all year round, and it's probably an indoor allergen, then you want to minimize the stuffed toys or pillows that pet has in order to minimize this type of allergen. Freezing the toys for 24 hours will also kill mites. So I know people that will put their toys in the freezer for 24 hours in the winter months. There are people that will take the dog mattress outside for a day or two, and that will help kind of knock them down. The other thing you can do is special filters in your house, so really change those often. You can buy the hypoallergenic filters that will help kind of get more of those out of the air. For pollens, this is my kicker out. Spring is always my hardest time of the year as far as pollens are concerned. So right now, you guys may be suffering too. It's a pretty bad allergy year as far as pollens are concerned. A lot of times news medias are having daily reports. You can go online every day. They give you a pollen report for our area locally. A lot of times it goes along with our weather reports. So be watching for that. You can keep track of it. When you know the pollen counts are high, keep your pets indoors a little bit more. Keep those windows closed like we talked about throughout the day. The biggest thing I tell people too now is wash those feet when they come inside. They're going out, they're closer to the yard than they're closer to the grass. They're taking in more of those pollens that will lead on. So wash those feet off, because once again we talked about that barrier defect. They're going to be able to absorb those pollens in more through their feet than maybe the regular dog. It doesn't have allergies. So wash them off. I used to tell people a baby wipe because it's hard to have a pail of water sitting next to them and dumping their feet in every time. Well, now companies have come out recently with wipes made specifically to help wipe your pet off, their feet off, to get those allergens off. So you've got a company that's now starting to produce those for pets, which is helpful. Keep your pet inside when mowing the lawn. Anytime I mow the lawn right now, I'm taking a shower right afterwards because you're getting those pollens right on you at that point in time. Molds. We see a lot of molds in houses. You might be surprised. Shower curtains, big problem that we'll see. Basements and bathrooms are kind of a big thing you guys are going to really want to keep watch on. Make sure some people are trying to keep their pets out of the basement, out of bathrooms. Houseplants, you know, keep track of those. I'm not so good about that, doing those, obviously, but, you know, watch and make sure that you're not getting some mold growing in those. We'll see that very commonly as well. Use the humidifiers, to make sure you keep that dry, and, make sure you kind of keep everything nice and clean. There it is out. And fleas, like I talked a little earlier about, you know, keep these pets on flea medications. This is just I just think I went and grabbed a bunch. I don't even know if I have all of them. I took a picture of all of our flea products that we offer here. I mean, there's just a lot of them. And so, you know, if you don't like topicals, we've got pills. If you don't like pills, we've got topicals. Whatever you prefer, we've got them at this point in time. So, at this point, there's really no reason to have fleas with all the products that we have at this point. Watch for animals coming into your environment that might bring them. See. So foods, I touched a little earlier about allergies that you may have as far as the foods are concerned. I tell people minimize the different types of foods that you feed your dog. So if your dog has allergies, and you may not know if it's got food allergies, but if it's got allergies to other things, it may well likely have allergies to foods. So the more things that your dog sees, the more things it can develop allergies to. So I tell people, keep it simple. Pick one type of food, pick one or two different types of treats, and that's really it at that point. You don't want to have them be, you know, you go to the store and get something different every other week, because then your pet's seen all of those foods and then has the ability to have a reaction to all those different ones. So pick one or two different ones. Limit table feeding. You know, we don't want them to be feeding off our plates as much as we enjoy it. It's just really not good for our allergy patients. Food allergies versus food intolerance. We're specifically talking tonight about allergies. So the allergies, the itching, ear infections, skin infections, swollen faces. Intolerances is when they just don't tolerate the food well. It's vomiting and diarrhea. And so we're not really talking about, when I talk about food allergies, I'm not really talking about the intolerance issues. I'm really talking about ones that will trigger infections. Trigger infections. Interesting enough, like I talked to you before, if they have food allergies, they can also have the allergies that we've already been talking about. So about 40% will have both. They will typically be all year round, so you know, you watch for that. If the dog is clinical all year round, it may be something in the food. We do see food allergies in younger animals more commonly. We talked about the 2-year rule, so at the age of 2 is when we start to see the allergy patients. And I'll see some of these allergy patients in at 6 months, 9 months, a year, so they kind of break that rule a little bit if they've got some food allergies. So the food allergies that you see most common, it's ones that they're coming in contact with most commonly. So beef and dairy are our top 2 agents that we see. Lamb has jumped up there now because lamb has become very popular in the last 5 or 10 years. To feed for allergy patients. Chicken is another one. You know, these 4 right now account for about 90 to 95% of the food allergies. So interestingly enough, you see grains on there, and it gets a lot of press right now, corn allergies, wheat allergies. When you look at statistics at this point in time, they're all saying the same thing, 5% or less of our pets, 5% or less are allergic to corn or wheat. So companies, pet food companies may want to sell you a product based on that, but think of the statistic, 5% or less, and that's just of the food allergy animals. Remember, the food allergy animals are only 5 to 20% of the total allergy. So if you take 100 animals that are allergic, 3% or less, actually even less than that because it'd be, you know, 1 would be allergic to corn. So be careful what you buy into as far as the foods are concerned. So the downside with food allergies is there's no real test for it. Blood tests and skin tests don't work. The IgE levels just don't match up with the clinical symptoms. So the only way you make a diagnosis on food allergies is when we do a food elimination trial followed by a challenge. So you feed one certain specific type of diet only for about 10 to 12 weeks. If the animal improves, then you go back to the original diet and you wait to see if the clinical symptoms come back. And if they do, then that's a pretty good test at this point in time. Then you see if that issue goes away. And then you take it again, and then you see if that issue goes away. So that's a pretty good test at this point to see. The hypoallergenic foods that we use, you've got different types. So we have what we call a novel protein source. So if you noticed, most of those food allergies were proteins. So we'll feed a protein that the animal's never been exposed to before. We talked about you can't be allergic to something necessarily that you've never seen before. There can be some cross reaction, but most of the time, if you've never seen it before, you can't really react to it. So we'll feed things like duck or kangaroo. They've never seen venison, proteins, those potatoes, those types of things. So there are pet foods out there that are specific for allergy patients that are made for these types of trials to see how they improve. We've also got foods out there that have the protein that's called hydrolyzed. It's packaged in a way so that when the animal eats it, the body can't recognize that protein. And so they can't trigger the immune system that way. Okay, so we've got those different types of foods that we use quite often. There's homemade diets that you can do as well. We don't have a lot of history with that, but there are websites out there that use veterinary nutritionists that will help formulate a homemade diet as well. If you're interested in something, we can certainly work with you on that. So food allergies are pretty difficult to accurately identify, and you can understand why. If you've ever tried to feed your animal something for 10 to 12 weeks and just that, it's difficult to know what they're getting into, especially if you've got kids around. It's really, really important for that to be the only thing that they eat, and that can be difficult to know. One thing also as we start to realize is over-the-counter foods are not good food trial diets, all right? This study came out this year, which was shocking. 40% of they did 52 different foods that they tested. 40% of them contained meat from a species that was not on the label. 40%, that's almost half, all right? You may not know, and actually, what's the pet food company that is really good at marketing right now? What's that? Blue Buffalo, yeah. Blue Purina is suing Blue Buffalo. I don't know if you knew about that for false advertising. And so Blue Buffalo actually just admitted in court 2 weeks ago that chicken byproduct was in their foods. They didn't know about it. They're saying that their manufacturer did it, and they didn't realize it. So there's we love to believe that the label is accurate, but tests are finding that it's not necessarily so. When you go to those foods that we were talking about earlier on the last slide, those prescription foods, the pet companies are making those for hypoallergenic diets, so they know that that has to be accurate. They're making it just for that reason. Blue Buffalo isn't making a food for allergy patients to do a hypoallergenic diet. Purina isn't either. So we've got to be careful what we do. In addition, there's this rule here that I don't know if you guys even know about it, but pet companies, they have 6 months to change a label. After they've changed something in their food, they don't have to tell you for 6 months. And they can change it back and never even make a change on the label. Number one, there's a lot of things that can happen that we may not even know about, and number two, there's not a lot of oversight. It's not there's somebody coming and testing every single food out there. So we just don't know what you're feeding sometimes, and so it's just important to make sure that we stick with the prescription foods as far as that elimination guidance. So we talked about symptoms. What does it mean to be allergic to something? We've shown you slides of what it looks like to be an allergy patient. Talked to you about some treatments that we can use, and then some ways for you guys to kind of avoid allergens at home, some tools for you guys to be able to do. So I just, now I want to kind of conclude and see if you guys have any questions or concerns or things to clear up at this point. Yes. So about an hour. That's straight up in the wall. Does it make sense what we talked about today? Do you feel like you have a better sense of what an allergy patient is and what it means to be allergic to something?
I think you did a very good job.
Good. So you